According to the American Cancer Society, breast cancer affects 1 in 8 women in the U.S. Many times a mastectomy is necessary, and the emotional, physiological, and physical effects of having the entire breast removed can be overwhelming for these women. Luckily, advancements in breast reconstruction techniques and surgical choices, such as single-stage breast reconstruction surgery, gives a lot of women hope.
My story was I was diagnosed with breast cancer in the left breast. And so I then had to make a tough decision. And that tough decision was to decide to go with, instead of a single mastectomy, double mastectomy.
Board-certified plastic surgeon Dr. Sami Bittar was recently nominated to Castle Connolly's Top Doctors for the Midwest region in 2013. He and his highly trained team combine years of experience with accurate surgical techniques in order to achieve superior outcomes in breast reconstructive surgeries.
Every patient who is contemplating mastectomy is a candidate for breast reconstruction. At least they should be given the opportunity and the choice. The procedure we devised is actually an implant procedure that does the whole reconstruction in one stage at the time of the mastectomy. We use the muscle from the back through an anterior approach. You make an incision in the back, use that muscle to cover the implants, and that would provide us with the opportunity to do the whole reconstruction in one stage.
Breast cancer patients can choose from a full spectrum of reconstruction options.
I offer everything actually, from a very complicated micro DIP procedure to a implant procedures, but the one I prefer the most after doing 4,000 or 5,000 procedure is the one we just published recently, which called the anti-approach latissimus flap. We use the patient own tissue. It would not affect their function, and it will finish the whole reconstruction in one stage. And especially recently now with the advent of nipple sparing, actually we can do the whole thing in one stage, meaning the nipple is saved and the breast mound is reconstructed at the same time of the mastectomy. So the patient comes for one procedure, the mastectomy and reconstruction is done. For me specifically, and of course for the patient, the aesthetic outcome is far superior than any other procedures that we've done in the past.
There are many psychosocial issues associated with breast cancer, mastectomies, and reconstructive processes that many women aren't aware of until they're diagnosed with breast cancer. These are things as plastic surgeons we need to be aware of and appreciate and understand where our patients are coming from.
When I woke up after my surgery, I had breasts already there, and I didn't have to go any additional pain or anything else through other additional surgeries. And so I was very, very happy with that.
Dr. Sami Bittar helps you actualize your unique goals of aesthetic and reconstructive treatment.